Hi, I'm Dr. Andy Evans, Deputy Director for Clinical Services at the Rutgers Cancer Institute, and very happy to be here at ASCO 2024 in Chicago. And I'm thrilled to be here with Dr. Missak Haigentz, who is our Chief of Thoracic and Head and Neck Cancer for Hematology Oncology. And this is a really big lung cancer meeting all of a sudden. I know it's all cancers, but Missak, there's quite a bit of thoracic here, isn't there?
It's an amazing conference, and I'm so thrilled to be able to be here. I'm always just pumped to be in this room, be in the room where it all happens. This year, there are just amazing abstracts that are being presented for lung cancer. In fact, 3 of the 5 plenary session abstracts are focused on lung cancer care. And these are the abstracts that are really going to change the way that we practice lung cancer care. Already we've seen results of a promising drug for ALK-targeted therapy, lorlatinib, that is really showing that people are living with this disease. And when I finished my training, we were just talking about it, we were 20-year members. The 5-year survival of lung cancer patients unselected was 4%. And here we found a population of patients where we gave a targeted therapy where people they haven't reached their progression-free survival, the median progression-free survival, at 5 years. In other words, people are living 5 years and tolerating their therapy and living better lives.
Yeah, that's exciting. And that's obviously at the national stage, and I know you help lead some of those efforts for us. But even at the Rutgers Cancer Institute, you're part of a poster presentation that's going to be happening here through the Big Ten Cancer Consortium, looking at a randomized phase 2 study of pembrolizumab in stage 1 non-small lung cancer. So first, could you tell us a little bit about the Big Ten Cancer Consortium and then maybe this research project as well?
Yeah, I'd love to talk about it. Thank you so much. So the Big Ten Cancer Research Consortium is a consortium of institutions that represent the Big Ten program that we talk about, whether it's basketball or football. If you've heard the news, we're adding a few to the Rutgers group, but it's a consortium of cancer researchers that are focused on uniting our efforts to battle cancer in the context of clinical trials. Really a great venue, particular for junior faculty members to get involved in cancer research and to design their own research studies to further their own careers.
And this was a randomized phase 2 study. You're allowed to give a little bit of the results. Is that a poster presentation?
Well, it's a poster presentation as a trials in progress abstract, and so this is an ongoing research study. So pembrolizumab, a drug that's revolutionized the way that we look at cancer and how we fight cancer, is increasingly being used in almost all subsets of lung cancer, with the exception of the oncogene driver subsets. So really the vast majority of patients can benefit from pembrolizumab. The one patient population that we have not adequately explored is the stage 1 patients. These are patients that generally have their tumors removed surgically, and we don't have enough adjuvant therapy data to support any extra treatment. So they just get their surgery, but still are at high risk for disease relapse. So really this clinical trial seeks to evaluate pembrolizumab in the postoperative setting to help improve disease-free survival in this patient population.
It's just exciting, that project, and it's just great that the Rutgers Cancer Institute and RWJ-Barnabas Health are involved with leading these pivotal national and sometimes global studies. Missak, have a great meeting.
Such a pleasure.
All right.
Thank you.